Now, some people always ask, why aren't they running? This is an emergency. Why aren't they there? These guys have got to reduce their stress level to make sure that they don't miss a beat what needs to happen. So they're trained to stay calm in these situations, but let me tell you, their anxiety and their level of stress is way up, especially when it comes to a small child. The lieutenant's going to interview the babysitter. It's important, as you learn the information here today, to be a good water safety person, that you have clear information so you can give to the rescuers so they know whether medical conditions, medical problems, what the relationship is, how long the patient's been down. That's all the information that he's trying to gather so he can get the medical crews that information. We're right now packaging the child to make sure, because little kids, when they're wet, they are slippery. So we want to make sure that we secure them. We don't know if there's a head injury or a neck injury when he's out there, if it was a diving accident. So we're going to package them up as quickly as possible, get them out of the water, and we're going to begin treatment. These situations, there may be one or more paramedics and EMTs. One of the paramedics will take the lead on the patient care, and he's the one who's going to give direction to the rest of the team. We're going to assess the airway. In a situation like this out here, we're going to want to get this patient transported and treated very quickly. And that's why we're calling for the aircraft, because this patient needs to be this child needs to be transported on the phone or downtown so they can have the best care. And make sure that care continues.
I don't want to do like work in the code.
The ambulance agency arrives, we'll get a pass on, we'll interact, and engage and assist in the treatment and transport. As they get all this information, when the aircraft comes, we're going to pass that information on to the aircraft crew. People also will ask the question, why did you stay so long on scene? Why didn't you just load them up and go? We can do just as much sitting here that the ER is going to do. In some cases, we need to get that done before we get them into an aircraft or back of an ambulance that's going to be going emergency down the road. It is very difficult to be in the back of an ambulance or in an aircraft and trying to do some of the things that we can do here in a controlled environment and a quick environment. Notice there's no screaming, there's no yelling, there's no unorganizedness to this crew in trying to do the best care for this child.
Go ahead and pick it up. We're going to go ahead and defibrillate 2 kilograms.
Again, the lead medic's advising the team what's going on. He'll give direction. One person's in charge at all times, and they're going to follow that lead.
Decompressions. Press it down.
Now what's going to happen here, they're going to transport the child into the back of the ambulance. They're going to continue that care, get as much information that they can to pass on to the crew of the aircraft. The crew of the aircraft's going to come out with their stretcher. They're going to interact with the ambulance crew and get as much information. And they're again going to do an assessment of the child as well. Being in the paramedical field in the past before I became a chief, once you're in the back of the aircraft, it's very hard to listen to lung sounds. Matter of fact, it's almost entirely, you cannot listen to lung sounds in the back of that aircraft. So they're going to make sure that the child has an airway. They're going to make sure that they've got good ventilations going on. They're going to make sure that the equipment is secure, and then they're going to transfer that patient over. Again, too, you'll notice as the aircraft came in, he did a circle. The pilot is the one who will determine whether the LZ is good or not. Usually what they'll do is they'll fly around that landing zone, make sure it's secure before they'll come into an approach. got them into the aircraft, 10, 15, 20 minutes maybe. So what do you think? My hope today is that no one has to experience what you just saw here today. So that's the whole purpose of this event, is that when you leave here today, you have some more knowledge and some skills. So let's talk about how we can reduce the risk being around the water. So what can we do for the water? We can use water barriers. We can have motion alarms around our residential pools, because remember, that's where the most drownings occur. We can have flotation devices readily available, so if they're still struggling, we can throw them something they can grab onto. So what can we do for the victims, potential victims? We can be responsible adults and supervise. Don't let anything take our attention away from kids that are in the water. We need to learn how to swim. We need to learn how to swim and interact with someone who's struggling in the water. We need to follow safety rules and pool behavior. And then what can we do as supervisors or people responding to help with the response? Learn CPR. Have a plan. Always have a plan. If you're going to go out on an outing on the water, have a plan if something happens. Anybody heard of reach, row, and go? Someone's struggling, reach out to them. Throw something to them. Get a boat, go to them. If you can't do any of those, go call 911. Don't get in the water and become another victim. Because if you're not trained to interact with someone who's struggling in the water, you're going to be struggling eventually as well. So please gather as much information as you can and learn as much as you can today. Ensure that your water activities are safe and enjoyable. And enjoy the rest of the activities and the rest of your days. And thank you, crew, the EMS crew, fire department. Thank you, sir, for life. And our community leaders to make this happen. Thank you.